Next, we will be doing cranial nerve 7, which is a motor function. So first, Deontay, I'm going to ask you to wrinkle your forehead and lift your eyebrows. And then wrinkle your forehead. Let me see yours. Wrinkle them again. Okay. So that was a normal response again. Good symmetry and a normal range of motion. An abnormal response would have been asymmetry and an inadequate range of motion. First, and now I'm going to ask you to close one eye at a time, then both eyes. Okay. Now, close your eyes. I'm going to try to open your eyelid, and you don't allow me to, pretty much. Good. So you have control over closing your own eyes, and you're able to keep eyes shut when given resistance. Again, the abnormal response would have been the opposite. An individual wouldn't be able to close their eyes individually, and they would not be able to overcome my resistance. Now I want you to show your teeth and smile. Now look at me. Okay, so pretty much what I'm checking for is the nasolabial fold. So when you smile again, these creases. And what I'm seeing is pretty much a normal symmetry, normal tone, and the opposite, an abnormal response, would have been asymmetry, and it would have been abnormal. Can you pucker your lips as if you're blowing a kiss? Okay. Mm-hmm. Pretty much symmetry, normal tone. The abnormal response would have been the opposite. And now I want you to, 3 times, I want you to alternate between smiling and puckering. Good job. So what that showed is that you have a normal response of symmetry and normal range of motion and control between motions. And then the abnormal response would be asymmetry and adequate range of motion and control between movements. Now, I'm going to ask you to frown and then pout. So pout means lower lip sticks out. So frown.
Okay.
Do you know how to frown?
No.
So it's like you're mad at somebody.
All right.
Frown.
Like, can we do this one over?
No, I think she'll enjoy the bloopers.
Okay. Excuse me. I'm not really good at frowning.
Okay. So we're just gonna say you have an abnormal response to frowning. Okay. So pretty much that's an asymmetry and abnormal tone. I just think that you're not able to frown because you're such a happy person, though. So I don't think you should worry. But yeah, pretty much you have a normal response would have been someone who was able to frown, which shows symmetry and a normal range of motion / control between the movements of frowning and pouting. And last but not least, I'm going to ask you to puff your cheeks with air. And then I'm going to lightly push your cheeks to see if any air escapes. Good job. And pretty much that was a normal response. An abnormal response would have been asymmetry and air would have